This training video is intended for friends, family, and work colleagues of someone who is living with a form of adrenal insufficiency. This video will provide some basic information about the condition, signs and symptoms when an individual may need additional medical intervention, and tips about how you can be a supportive and informed friend. Disclaimer: this video was created by a non-medical professional with input and collaboration from endocrinologists, nonprofit patient advocacy organizations, and adults living with adrenal insufficiency. All information should be reviewed and approved by the patient's endocrinologist prior to using this video for any training purposes. Some people have a life-threatening endocrine condition called adrenal insufficiency. This term refers to any medical condition when a person is unable to produce enough of the essential hormone, cortisol. Some forms of adrenal insufficiency are also unable to produce enough of the essential hormone, aldosterone. There are many types of adrenal insufficiency, including genetic and autoimmune forms, and many other forms that are the result of a variety of other medical conditions that have impaired a person's ability to produce cortisol. Cortisol is the body's primary stress hormone and regulates a variety of crucial body functions, including regulating glucose, blood pressure, insulin, and heart rate. If a person is unable to produce enough or any cortisol naturally, the ripple effect on overall health and sense of well-being is vast. Individuals living with adrenal insufficiency are dependent on daily medications to live. Adults usually take hydrocortisone, prednisone, prednisolone, or dexamethasone to replace cortisol, and fludrocortisone to replace aldosterone. They also carry an emergency kit that includes an acto vial of solucortef, which is an injectable form of hydrocortisone. Treatment needs can be divided into three main categories: normal day dosing, stress dosing, and an emergency or adrenal crisis situation. Those of us who don't have adrenal insufficiency produce significantly more cortisol when we are sick or injured. An AI patient needs this cortisol boost replicated using more medication to enable their body to respond appropriately to the stressor. Let's review the signs, symptoms, and necessary responses for each scenario. If you weren't watching this video, it is likely you would never notice anything medically different about your friend at all. Most days, the standard daily maintenance dose is sufficient to keep a person healthy and able to participate in all normal activities. Just like someone managing diabetes, a person with adrenal insufficiency is able to live a relatively normal life by taking their daily medication and paying close attention if any concerning symptoms develop. In times of illness or injury, the body requires significantly more medication to respond to the stressor. This scenario is called stress dosing. An AI patient is usually given double or triple their normal dose of medication immediately once symptoms are noticed. Each patient's stress dosing protocols vary. It's important to note that giving a person a little too much hydrocortisone, prednisone, prednisolone, or dexamethasone occasionally should not harm the patient if they are showing signs of an illness or injury. However, giving too little could lead to symptoms escalating. In times of severe illness or injury, your friend may require an emergency injection of hydrocortisone. These scenarios are rare. Most often, if an AI patient were to experience an emergency while in your presence, they likely would have mentioned symptoms they were experiencing and may have already taken a stress dose. If symptoms were to escalate, the patient may quickly be unable to advocate for themselves or administer their own emergency injection. Your role may involve calling the local emergency services number and injecting the patient while awaiting an ambulance. Because many emergencies arrive swiftly, and some regions have inconsistent or unreliable emergency response from ambulances or hospital emergency rooms regarding responding to an adrenal crisis, it is vital that any friend, relative, or work colleague have at least a baseline understanding of the symptoms of an adrenal crisis and how to administer the emergency injection. Your friend living with adrenal insufficiency will be able to share how common or infrequent these emergency scenarios have been in their medical history. They will have an emergency kit with them at all times, with all necessary medical supplies, including documentation with clear instructions. Any friend, relative, or work colleague should know what this kit looks like and where to find it. A patient experiencing a potentially life-threatening adrenal crisis may present with symptoms including nausea, vomiting, or diarrhea, dizziness, pale skin, stomach aches or headaches, lethargy, confusion or delirium, low blood sugar, low blood pressure, fast heart rate, seizures, or shock-like symptoms. A patient may appear intoxicated. In a rare emergency situation, when the patient may not be able to ingest oral medication or is vomiting repeatedly, an injection of Solu-Cortef will be needed to stabilize the patient. To give Solu-Cortef, follow the dosage guidelines and instructions provided in the patient's emergency kit. The following slides will very quickly review the steps to give the Solu-Cortef injection. To give the Solu-Cortef injection, first check the expiration date, then push the entire top of the vial down hard to release the stopper inside the Actovial. Mix the powder and solution. Do not shake, just gently swirl the vial until the medication is mixed completely. Check the patient's dose. Remove the small plastic tab at the top of the vial. Clean the top of the vial with an alcohol prep pad. Open the syringe and draw air into the syringe equal to the level of the patient's dose. Insert the needle into the vial, invert the vial, inject the air, and pull back the plunger until you have the correct dose in the syringe. Remove the needle from the vial, then remove any air bubbles from the syringe. Identify the injection site on the middle outer portion of the patient's thigh. Then wipe the skin with an alcohol prep pad. Finally, jab the needle into the patient's thigh and inject the Solu-Cortef. After giving the injection, the patient may improve drastically within about 10 minutes, but they still require monitoring and should be transported to the nearest hospital. Depending on the cause of the crisis, other aid may be needed. The patient's adrenal crisis symptoms should be treated with urgency when prioritizing what aid to administer, and the Solu-Cortef injection should be administered prior to being transported to the hospital whenever possible. If someone has given the patient their emergency injection prior to first responders' arrival, pass along any medical supplies, including the used Actovial of Solu-Cortef, and any documentation related to the person's medical care, to the ambulance staff. This will aid in the transition of care to the hospital. In addition to the logistical details of managing adrenal insufficiency, individuals must also navigate the emotional and psychological aspects. Adrenal insufficiency is invisible to others, which makes it common for those closest to AI patients to forget that their friend may be struggling in unseen ways. Though this differs for each individual, it's important to remember the emotional toll that it takes to manage the variety of symptoms, medication side effects, and extra protocols and preparedness necessary to live a seemingly normal life. Please take a moment to read these suggestions about how to be supportive and what behaviors to avoid. This is a lot of information, but the main reason you are watching this video is merely to be aware and attentive to the signs and symptoms that may warrant a medical response. Ask questions until you feel confident in the protocols, and whenever in doubt, the best course of action is to overreact, which may be as simple as encouraging your friend to take additional medication or take a break. Thank you for taking a few minutes to learn about adrenal insufficiency and what your friend, relative, or work colleague needs to remain safe and healthy.